Alright everybody, I'm back. My name is Nicholas Ricca. I'm a physical therapist here in Florida. I'm here to extend our conversation about dizziness. So most people think dizziness automatically means vertigo, but that's actually not true. I recently just had a patient come in last week and they were describing symptoms of dizziness. They weren't sure if it was spinning, but they were getting really dizzy when they would bend over to pick something up off the ground or maybe look up to wash their hair in the shower. I tested this patient for traditional BPPV, which I described in my last videos, and they were negative. But every time we got up and down, they were getting dizzy and they weren't sure why. This brings up a really important point, is that not all dizziness is traditional vertigo. For example, both high and low blood pressure can contribute to dizziness, especially when people are changing positions, getting in and out of bed, bending over, or looking up. A lot of this can happen for a brief moment. You experience unsteadiness, feeling of off balance, maybe not the traditional spinning type of dizziness you would expect, but something doesn't feel right. Maybe you feel like you need to sit down. This can happen as the body is struggling to regulate blood flow for a brief moment of time. Maybe your heart's not pumping as strong as it should be. You have something contributing to the poor venous flow, arterial flow, such as peripheral vascular disease, hearted arteries. Maybe you've been having low or high blood pressure for a long time, and so your body doesn't detect the changes as quickly, and it needs an extra minute to respond and adapt to the change of positions. The many questions I ask when I first meet a patient is if you've had any changes to your medications recently. A lot of times you've been on one medication for a really long time. Maybe they didn't change the medication, but they may have changed the dose, and so your body needs time to respond adequately to the dose change, and so that can regulate your blood pressure a little differently than it's used to for so long. There's other medications that can cause dizziness, and so you can talk to your primary care, make sure they're looking over your whole list of medications to ensure that none of these are one of the reasons you're having dizziness. There's the balance system itself. This can definitely cause dizziness. This is something that we call a hypofunction of the inner ear, and it's when that vestibular nerve just isn't sending as strong of a signal as it used to, and so it takes an extra second for your brain to regulate the change of positions, or maybe looking left and right. It's got to take in all that information, and it's not doing it as well as it should be. And so for these patients, we do a lot of vestibular training. That's where you get the old-fashioned eye exercises or looking left and right exercises. These patients usually describe feeling off balance. I get a lot of, I feel like I'm on a boat or just got off a cruise ship type of feeling. They're more motion sensitive, but not the traditional I'm really dizzy or I'm having this spinning type of sensations. Let's say we ruled out all these other forms that could be causing dizziness, but we're still not exactly sure. A lot of times dizziness can tie into the neck and lead to what's called cerviogenic dizziness. It's a big term. It just means dizziness that can be caused from the back of the head. Some people get headaches, but some people may experience dizziness due to chronic neck dysfunction, tight muscles in the back of the neck that could be contributing to pain or loss of range of motion. And so what we'll do is an exam to look at how the spine and the muscles are moving and how much range of motion you have in your neck, to see if any of this could be contributing to some of your dizziness as well. So when someone says I'm dizzy, I don't automatically think vertigo, but I think a lot of patients usually jump to that because that's one of the most common heard about symptoms that people get, but it's not always a crystal issue. We need to figure out, is it lightheadedness, is it motion sensitivity, is it traditional vertigo, or maybe that feeling of off balance, or are you feeling faint? So we have to answer these questions first to start in our direction of care, because everyone experiences maybe dizziness a little bit differently, and they can point us to different treatment methods that we need to look at. Big takeaway here is that dizziness is not always vertigo. There's a lot of other systems that can cause dizziness, whether it's your cardiovascular system relating to your blood pressure or heart, or the way your body pumps blood through the system. It could be from your neck, it could be from your inner ear, or it could just be medications. So we got to look at the whole picture to help treat you as an individual. That's why getting a good assessment is very important. Talking to your primary care, your physical therapist, and even your ENT if they're involved as well. If you've been experiencing dizziness, lightheadedness, motion sensitivity, or feeling faint, hopefully this video helped guide you in the direction you need to be, and hopefully is educational for you, so you get help starting with your own treatment and talking to the next person that you feel like needs to be involved. And if you need more video breakdowns of dizziness or balance problems, I'm happy to oblige. I have a lot of fun working with patients like this because they get a lot of help pretty immediately, and they're able to help themselves in the long run, and people do get better. So you're not alone. Follow along for more content. Thanks.